If you are over 65, stop whatever you're doing and listen carefully. What you're about to hear goes against what most people believe, but surgeons, physiotherapists, and mobility researchers already know this truth. Walking is healthy, but walking alone is not enough to keep your legs strong as you age. If walking alone truly worked, older adults who walk every day would not struggle to climb stairs. They wouldn't have difficulty getting out of a chair. Their knees wouldn't feel weak or shaky, and they wouldn't lose balance the moment they step on uneven ground. Yet, this happens every day. Medical professionals see it constantly. People who walk regularly, sometimes for miles, but their muscles continue to weaken. Their balance declines, and their risk of falling increases every year. The reason is simple. Walking only uses a small portion of your leg muscles. It does not strengthen the muscles that age affects the fastest. So, stay with me for a few moments, because you're about to learn 3 surgeon-approved exercises that build more leg strength than walking, especially after the age of 65. These movements are gentle, they are joint safe, and they are chosen specifically for older adults who cannot do high-impact or risky exercises. Exercise 1. The chair sit to stand. This is one of the strongest indicators of independence after 65. Doctors often use one simple test to understand an older person's strength and mobility. Can they stand up from a chair without using their hands? This single movement reveals leg strength, balance, coordination, and fall risk. A sit-to-stand activates the muscles that protect you as you age: the thighs, hips, glutes, core, and the stabilizing muscles around the knees. Walking barely activates these muscles. Standing up from a chair activates all of them at once. To perform it, sit on a sturdy chair with your feet shoulder-width apart. Lean forward slightly. Push through your legs to stand up, then slowly lower yourself back down. Aim for 8 to 12 repetitions. Rest, then repeat for a second set. If you need to use your hands at first, that's completely fine. Over time, your legs will grow strong enough to support your body. This movement trains the exact pattern you use every day: getting up from a bed, chair, sofa, toilet, or car seat. Walking does not train this movement. Exercise 2. Heel raises. When people talk about leg strength, they usually think about the thighs and hips, but the calves play a critical role in balance and stability. Your calves push your body forward, stabilize your ankles, and help prevent falls. After 65, calf muscles weaken faster than many other muscles, and walking does not strengthen them enough to stop this decline. That's why these muscles are sometimes called the second heart of the legs. To perform heel raises, stand near a wall or chair for support. Slowly rise onto your toes. Pause briefly at the top, then slowly lower your heels back down. Perform 12 to 15 repetitions for 2 to 3 sets. Stronger calves mean better balance, steadier steps, and greater confidence, especially on stairs, uneven ground, and slippery surfaces. Exercise 3. Marching knee lifts. One of the most common mobility problems after 65 is weak hip muscles. These muscles lift your legs. They help you climb stairs, step into a car, lift your feet over curbs, and avoid tripping. Walking does very little to strengthen them. That's why many older adults begin to shuffle or trip despite walking daily. To perform marching knee lifts, hold a chair or counter for balance. Lift one knee as high as comfortable. Lower it slowly. Switch legs. Repeat 10 to 15 times per side for 2 sets. This exercise retrains your body to lift your feet safely and confidently with each step. Why these exercises matter more than walking alone. Walking is important. It supports heart health, circulation, and endurance. But walking does not prevent muscle loss. After 65, muscle strength declines every year unless you actively challenge it. Walking builds endurance. These exercises build strength. Endurance helps you move. Strength helps you stay independent. Walking keeps you healthy. Strength keeps you safe. You need both. Final message. If you feel too old, too weak, or too late to start, you are not. Muscles can grow at any age, even in the 70s, 80s, and beyond. Research and real-world experience prove this. Your body is not failing you. It simply hasn't been given the right signals. Walking sends one signal. These exercises send the missing ones. Practice them safely. Be patient with yourself, and step by step, your strength can return. Your independence depends on your legs.